Good afternoon. As you may have seen, the Department of Justice has opened the application process for the Radiation Exposure Compensation Act, also known as RECA. We expected this form to be released sometime in September or October, and we're thankful that the federal government has moved so quickly to make the application available. In doing so, however, it's forced our county government to move more quickly than expected, and that's okay. My office is working closely with council members Rita Days, Shalonda Webb, and Gretchen Banger to help inform all of the impacted residents. Departments across county government are working to make sure they have the resources in place to help our residents get the documents they need to complete the RECA claim form. So let me take a minute to explain RECA. RECA compensates individuals who developed cancers or certain other diseases due to radiation exposure from the U.S. nuclear weapons testing or from uranium mining. Earlier this summer, Senator Josh Hawley was successful in expanding RECA to extend coverage to certain or former Missouri residents who are exposed to radioactive waste produced by the Manhattan Project, or including those who lived close to Coldwater Creek. Current and former county residents and individuals who lived, worked, or even went to school in the impacted zip codes after January 1st, 1949, and contracted certain cancers after working or living or going to school in these impacted zip codes are eligible for compensation. This compensation includes either a one-time payment of $50,000 or a reimbursement of out-of-pocket medical expenses with no cap. And this expansion is unusual as it also includes survivor benefits. Survivor for next of kin of someone who has passed and was diagnosed with one of these cancers and who lived in the impacted zip codes. The survivor benefit is $25,000, which is split amongst the beneficiaries and is tax-free. To ensure that St. Louis County residents have accurate information, St. Louis County government has created a website, and you can get to that website through stlouiscountymO.gov. From that page, you can also download the claim form. To apply for compensation, there are several documents that are required to prove eligibility. Many of those will be requested through St. Louis County, including marriage certificates, death certificates, property records, property tax records, even voting records. For the process to obtain those documents, you can learn more at our webpage. The Department of Revenue has already been inundated with requests for records, and I hope to have more details on the level of demand in the coming days. Some additional support may be needed to help our residents get the records they need in a timely fashion. So we'll be watching that closely. Estimates are that we expect up to 300,000 people to be eligible for this compensation based on where they lived or worked or attended school. So I encourage anyone who may be eligible for RECA to visit our webpage, stlouiscountymO.gov, and click on the RECA Claim Form Now Available button. And that'll take you to the webpage that you see here. Joining me today is Danielle Spradley, who is part of our community outreach team. She worked on RECA expansion when she was on staff of Congresswoman Cori Bush, who was credited by Senator Hawley recently as playing a key role in getting the RECA Compensation Act passed. Danielle's family is also impacted by radiation exposure. So this is both a professional and personal priority for her, and I appreciate all the work she's done on this. Danielle will take us through a truncated version of a slide deck, which she has been sharing with community leaders, municipal leaders, nonprofit leaders, and other folks to help them understand the RECA program so they can in turn share it with families who might be eligible for compensation. Danielle.
Thank you. Grab this. All right. Hello, everyone. So as Dr. Page said, that we have been working closely with Senator Hawley's office and Just Moms STL to educate the community, whether that's mayors, council members, senators, elected officials, community organizations, about the RECA program, to make sure that accurate information is going out about the program. So this is a pared down version of one we recently showed at a stakeholder meeting for a lot of our elected officials and hospital representatives, that goes over the Radiation Exposure Compensation Act. And this is available on the webpage for everyone to use if they want to educate someone in their community. And we will also go anywhere and talk to any community that needs more information on RECA. So it goes into what the Radiation Exposure Compensation Act is and how it passed, and what this means for St. Louis County. As Dr. Page mentioned, we are expecting possibly up to 300,000 people being eligible for RECA benefits and survivor benefits in St. Louis County, which means a major lift on our departments to ensure that we get the documents that folks need in a timely manner. And on this, we show the St. Louis County impacted area codes on this specific map, and then go into what area codes are included in Missouri, because also there is a St. Louis City zip code and also some St. Charles County zip codes as well. We also go into what cancers are eligible on this presentation. How impacted individuals apply, and of course on the webpage, the application is available on the webpage, including links to different resources, what documentation can be used, and then who can help you assist in finding these documents, whether that's the library, whether that's municipalities, the county, whether it's federal and state offices, letting people know where they can go for specific documents. Also, who can help assist people with filling out applications, whether that's our congressional delegation, so Senator Hawley's office, Congressman Bell's office, Senator Schmidt's office, Congresswoman Ann Wagner's office, and in St. Charles, also those congressional delegations can help answer questions for folks. And then we also want to warn people about a fraud alert, because we've already seen cases where there are people saying that they are an attorney and they will fill out their applications for people. This was before the application was even out, trying to charge exorbitant fees for helping to fill out these applications. By law, they can only charge 2% to help someone fill out an application. And if you are getting calls of someone trying to charge you exorbitant fees to help you fill out your application, please report that. They are looking at prosecuting those folks. You can call the Attorney General's office and report it there. Also Senator Hawley's RECA hotline and the Department of Justice. And then we also provide here, if you have questions regarding RECA, on the federal level, the best person to call is Senator Hawley's office, and he has his hotline. Also, Just Moms STL has good information on how to help you find different ways of helping you find documents. We also have the St. Louis County RECA support at stlouiscountymo.gov that can help you with any information you need on getting documents from St. Louis County. And then I think it is open yet. There will be a community resource hub through the Pink Angels Foundation at 620 North Lafayette. And then also we have some commonly asked questions, because a lot of folks, there are many people, including my sister, that has multiple primary cancers. So is she eligible for three $50,000 benefits? No, it's only one. You get a one-time benefit. And then also into some other commonly asked questions. And the applications as of now are going to be due December 31st, 2027. So people want to make sure that they're getting their documents now and getting these applications in. And then here we also have some trusted resource websites listed. And again, there is a link to this presentation on St. Louis County's website. And then I want to go back and show you some important things on the website as well. We have those same resources listed here. So we have RECA resources and then community resource hubs. We will be updating this when new information comes in, when new resource providers come in. We will make sure that everything on here is up to date with different partners that are helping folks. And then also, if you see these drop-down menus, this will have exactly what documents you can use. And then also links to where you can obtain county documents. For example, voting records from the Board of Elections. There's a link to that submission form. Links to our health department and links to our Department of Revenue. And that's all I have.
Thank you, Danielle. We'd be glad to answer any questions. We expect almost $4 billion, maybe a little bit more, to flow into the St. Louis region to help families who have been impacted by radiation exposure. This effort has been going on in St. Louis County now for 3 decades to address radiation exposure in families who have been impacted. This is one of the biggest issues that we faced in a long time, and it's really important that you help us get the word out, to refer people to our website, to make sure that people who are eligible are asking questions and getting the necessary documents they need to be compensated for exposure to radiation and the health impact of that.
County Executive Page, do you plan to have any kind of specific office set up to help people with the application process and obtain the documents they need, or maybe pop-ups throughout the community?
What we're going to do is, first of all, Danielle Bradley will be point on this. She has a long history of working on this issue. She understands it deeply. Our first role will be to get the application out there. It'll be available electronically in December, but right now it's only available by paper. So it's a little bit more difficult to manage, and the documents have to be certified, but there was a lot of eagerness in the community to get this going because it's time limited, and we want to get people started with the application. The role of county government will be to educate folks on the federal program, how to apply, and what you need to do to apply, and then to be one source of documents to establish residency for at least 2 years after January 1st, 1949, residency at least 2 years to prove eligibility. But folks will have to gather medical records, and there's a lot of information needed. So our role is to communicate what is needed and where possible, provide some of the documents that help establish residency.
Going off of that,
one more thing. We will also be tracking data around this as far as who is interacting with our departments and making sure we have the bandwidth to manage this, because this is a 2-year time-limited program, and we want to make sure we have the appropriate resources to make sure people get access to their documents. And we have agreement amongst the council. We're all united on this. We're all working together to make sure this program rolls out in St. Louis County, and that St. Louis County is doing their part to provide the necessary documents. I'm sorry that was a long answer. Yes?
Sorry about that. I didn't mean to jump in there, Dr.
Okay.
Page. How imperative, knowing all of what's required, 24 pages, that the county works hand in hand to try and streamline this as much as possible?
Well, our residents expect that this application will be available, and that all of our governments, local, state, and federal government, will be working closely together to make sure that they get the documents they need to fill this application out. And it is a little bit complicated. And folks, we haven't seen anything like this before in Missouri. Missouri residents, current and former Missouri residents, were added to the RECA program, which is long established in the United States, but it's new to us. And we're different because we have survivor benefits. That's a new part of the program. So there's a lot of nuances here, and whenever you do anything new, you have surprises. So not only do we need to get out there and help people, but we need to watch really closely for hiccups and then get on it quickly. But our county government is united in addressing this problem. The state government is working. They have resources available as well, and Senator Hawley's office is pretty engaged in this.
I have a question for Ms. Bradley. As someone who's personally affected by radiation exposure and worked on it for a long time, how does it feel for you to finally have these applications open?
It's amazing. And it's so many people worked on this. I know Dr. Page actually worked on it when he was a state representative as well as these issues. So many people worked on this for so long and fought so hard. Representative Doug Clemens and others, Just Moms. I think it's wonderful. Everyone who's impacted that deserves compensation for the federal government to acknowledge what happened here.
Is there a timeline? This could be for both. When do you think the first checks are going to get cut? Or when will people actually see money from this?
That is a question for Senator Hawley's office and the DOJ.
What are your thoughts about it? Does he deserve credit? Did he get this over the finish line? I mean, I know people have been working on this for decades. We've been covering it for decades. And now here we are, 2025, Republican-controlled Congress. And he sort of took the baton on this.
Yeah, I think he did a great job, along with, as he said in his press conference, Congresswoman Bush putting pressure on, and also all the community advocates that worked on this for so long too. Yeah, of course he does.
Yeah, and I think you have to shout out to Karen Nichols and Don Chapman. They've been driving this for a couple of decades and didn't give up when a lot of people told them, this isn't going to happen. And they didn't quit. And Coldwater Creek advocates didn't quit. But Senator Hawley got this done. It was a bipartisan effort. He deserves credit for it. But this is a bipartisan effort. Former Congresswoman Cori Bush was, driving this, pretty hard too. And this is what happens. Things like this happen. You can solve big problems in your community and in your country if people work together. And this is a really good example of that. It's a really big problem for our community that has a path forward. Yes?
Ma'am, you mentioned you've been working on this for years. What does it mean to you that this day is finally, your applications are finally going out to people who need help?
It means that people will get the help they need, and it doesn't replace family members' loss, and it doesn't, you don't want to have cancer. Nobody wants to have cancer, but at least it's a start to helping people, and it means the world.
Is it a little overdue for you? I know you said it impacted your family.
Absolutely. And the thing for me is I didn't know it impacted my family until I started working for Congresswoman Bush. And I started asking my family questions and then realized that they grew up playing in the creek and then all had cancers. I just recently learned 3 years ago that it impacted my family. So it's a huge deal for people that have been sick for a long time.
Is the $50,000, is that, so a family of 4, is that for $50,000 or is it per family? How does that work?
So it's 50 per person, right? So the $50,000, and there's also the option, so it's $50,000 tax-free per claim, so that's per person. If there are 4 members in a family that have a cancer, a primary cancer that's one of these impacted cancers, they can also file a claim. And then with the survivor benefits, it is next of kin, so direct children, and they have to split the $25,000 among all of them. And the DOJ will, if you try to not tell them about a living beneficiary, they will find them.
If you opt for the out-of-pocket expenses, is that just for one illness or for any qualifying illness?
I would ask Senator Hawley to make sure, because I don't want any wrong information to go out on how they handled the medical expenses.
Where did the number 4 billion come from?
Do you know that?
Yeah, that came from, I had been told this by Just Moms STL and them looking at the CBO scores on this legislation.
That's just the slice for St. Louis region, right?
Yeah, the $4 billion estimate of funds that will flow into the St. Louis region to compensate people who are impacted by radiation exposure was created by the Congressional Budget Office, and they estimated the fiscal impact of this when it was added to legislation. So it's a congressional estimate.
What happens to people who have ongoing medical procedures even beyond the deadline. Is there another round of funding that comes in the future, or do they need to?
Danielle, you can predict the future.
So
what happens if you're still getting treatment and the reimbursement is no cap, but obviously if you're going to have expenses in the future, I don't know how that works.
So I think Senator Hawley is probably best to answer this, but I think that the program needs to be reauthorized. So RECA has to be reauthorized on a regular basis. So I'm not entirely sure what happens with that, and I think Senator Hawley's office can give you a more accurate answer. But I do know as far as the program after December of 2027 needs to be reauthorized.
Okay, so that's why it's the cutoff date. That's just when it's authorized until.
Mm-hmm. Correct.
Any other questions?
Are there concerns about people not recognizes that they don't have to live here anymore?
So I think, one of the ways I was made aware of this issue was Coldwater Creek Just the Facts. And a lot of the folks, how that started was people that went to high school here and all realized that they were sick, but they didn't live here anymore. So yeah, I think there's a lot of people that have moved away that don't know this is happening. And that's why getting the word out as much as possible to let people know you don't have to live here anymore. It's if you lived here when you were a child, if you worked here, if you went to school. For example, students that were bused in from St. Louis City to go to schools in the county and they have these cancers, they're also eligible. And so that's making sure that we spread the word, which is why we're here today and need you to help do that.
I think this is an example of, people talk about a subset of folks who will look around the community and say, that isn't right, somebody should do something about it. And then there's a subset of those people who will look around the community and say, that isn't right, I'm going to do something about it. And this is an example of a group of residents who decided they were going to do something about it and didn't quit. And that's why this is a law. They finally, after decades of pushing, got this done. And I would recognize and hope people in the community who look around their community and see something that isn't right, I hope they stand up and say, I want to do something about it, and follow the model here, because you can change things if you stay on it. And that's exactly what Just Moms STL and the Coldwater Creek folks did. They stayed on it, and they deserve the credit for this. Thanks.
Dr. Page, can I ask you a question? It's about your future political aspirations. Do you plan to run again? It's been some confusion. I've heard reported, yes, you're in, no, you're not. What can you tell us about that?
Well, first of all, I won't be making any announcements, as I always do, about my plans for the next election cycle until the end of the year before. I'm always prepared, but I'll make a formal announcement when we're closer to the election. Right now, I'm going to do the work of running county government. There is a lot of work to do.
Have you had any response to people who said maybe you should step aside for the criminal charges?
I'm not going to answer any questions, and I understand you have a job to do and you have to ask these questions, but you also have to understand that this isn't the place for that, and there'll be a time and a place, but it's not right now. But right now, I'm going to do the work of running the county. I don't think I did anything wrong, and we'll cooperate with this investigation, but there's a lot of work to do in St. Louis County, and I'm going to keep doing it.